Next, we're going to review the steps that are necessary to investigate an outbreak. Epidemiology is not a science that's conducted in a vacuum. Epidemiologists are on the field every day, putting their expertise to work. One way the epidemiologists apply their knowledge is by using the 10 steps involved in investigating an outbreak. These are the 10 steps that we use. We establish the existence, get ready for field work, verify the diagnosis, define and identify cases, use descriptive epidemiology, develop a hypothesis, evaluate it, refine it, implement control and preventative measures, and then communicate findings. Only in theory, however, do these proceed in order. In practice, they are adjusted. So let's look at these 10 steps in terms of the Legionnaire's disease that we talked about previously. After such a substantial number of American Legion conference attendees with similar symptoms were admitted to hospital emergency departments or examined in doctors' offices, an initial investigation began. During step 1, the epidemiologists were able to establish the existence of this outbreak by reviewing records and data from many sources that confirmed the disease cases, which were thought at the time to be pneumonia only. They were indeed higher than normal from the previous weeks or months. In step 2 involved preparing for field work. In this, they began by researching the outbreak, gathering their supplies, making travel arrangements, and consulting with other entities on site, such as healthcare workers from the local health department. They then determine the roles and make local contacts. So they're getting ready to do their investigation. During step 3, the epidemiologists ensured that the problem was accurately diagnosed by speaking with patients and reviewing laboratory findings and clinical test results. After the diagnosis were established, a standard set of criteria, also known as the case definition, was established as step 4 to determine whether any individual person would be categorized as having that disease or condition. There's 4 components typically used in a case definition, and what we include in that is clinical information about the disease. What are the signs and symptoms, and what have we observed? 2, we get characteristics of those affected. Are there commonalities that exist between those that are ill? Thirdly, we get information on the location or place where this happened, where they were located. And lastly, we look at the time. When did it begin? What was the duration of symptoms? During an investigation, the case definition may evolve as more information becomes available. So to assist with this investigation, public health nurses made rounds at local hospitals in Philadelphia to gather information about those who were ill and to verify the diagnosis. In addition, lab samples and clinical examinations were tested and reviewed. Once the case definition was established, then healthcare facilities such as hospitals, doctors' offices, health department, etc. were contacted and given the case definition, and also requested that any of individuals who come to their facility who meet this definition would also be reported. Step 5 involving using descriptive epidemiology to describe the Legionnaire's disease and orient the data. They identified who, what, where, when, why, and how. After these were identified, the epidemiologists proceeded to study the dates, the times, and the places and persons involved. This graph indicates the number of Legionnaire's disease cases by day in July and August of 1976. Remember, these are the number of cases, not the disease rate. The arrow indicates that the number of cases peaked from July 25th to July 27th, and then the numbers begin to decline thereafter. We can infer that the number of cases started soon after the convention began. By the end of the convention, the number of cases had reached its peak. However, this descriptive analysis only tells us what can be read directly from the graph and data. Analytic processes take us one step further to a hypothesis and assessment of the cases for the trend identified by the descriptive analysis. This table lists the rates of illness among American Legion delegates by age and where they were staying, Hotel A or another hotel. So let's see what the data tells us. So if you look at this, we have in Hotel A, we're looking at the ages, and we're looking at the number that were ill and the percentage. This kind of gives us a picture of what was going on between these three hotels. If we look at the age group that has the highest percentage of ill persons in those aged 70 years or older, and this was the highest percentage regardless of where they were staying, except for Hotel B. It is a little bit lower there. Combining all the age groups, those who stayed in Hotel A had an increased percentage of illness, 9.9% versus 5.4% in other facilities. We can infer from this data that a connection exists between staying in Hotel A and becoming ill. We can also infer that older persons appear to be more susceptible to this illness. During steps 6, 7, and 8, a focus hypothesis, which is the theories that can be tested for validity about Legionnaire's disease, were developed regarding how and why the outbreak occurred. They are then evaluated for validity and refined as needed. One hypothesis stated that the illness was associated with convention attendees who were guests at or had visited one particular hotel during their time at the convention. Epidemiologists on this outbreak investigation tested this hypothesis by conducting a randomized telephone survey of the guests registered at the 4 hotels during July 6th through August 7th, including hotels where conventioners had stayed or had not stayed. Reviewing hotel data by interviewing hotel employees who had become ill during the convention, they also reviewed hospital emergency room admission data. They collected environmental samples from selected locations in Hotel A, and then they reviewed whether records from there was any correlation between weather events and illness. They also interviewed hotel guests and workers about places they had visited, people they had met with, and food they had eaten. In addition, finally, they conducted 2 case control studies to round out their investigation. Although exposure to the outbreak apparently occurred over several days, investigation results were initially unclear. Researchers were unable to really locate the bacteria that caused the Legionnaire's disease outbreak because of difficulty in growing the bacteria under laboratory conditions. 5 months after the first cases of Legionnaire's disease occurred, results of the case control study indicated that spending time in the lobby of Hotel A was a risk factor for illness. In December 1976, a CDC laboratorian successfully located the source bacteria after continuing to test the specimens that were thought to be dead. A new bacteria that had caused this disease was discovered. After isolating the bacteria, conditions at Hotel A were investigated to determine their connection with the onset of illness. Similar bacteria grew in warm waters in nature, such as hot springs, and also had been identified in air conditioning cooling towers. Investigators concluded that those who had become ill in Philadelphia had inhaled air from the air conditioning unit at Hotel A, either as guests or while walking on the sidewalk outside the hotel. They also noted that the hotel workers who had not become ill were believed to have built up a form of immunity to the bacteria, which explained why the outbreak did not appear to have affected the hotel employees. After the cause of the disease was identified, outbreak investigators moved on to step 9. To minimize growth of the bacteria that causes Legionnaire's disease, controls were implemented such as chlorination of water and testing of industrial air handling systems. During step 10, investigation findings were communicated to local health authorities, the the medical community, the general public, and lawmakers and other leaders. Usually, the findings are reported as an oral briefing to health authorities and those responsible for implementing control and prevention measures. During the briefing, epidemiologists describe what they did and how they did it, what they learned, what should be done about the illness. Reports are then written and details of the findings are presented. So this is just a little case study that shows you what happens in an epidemiological event and the process that takes place. So thank you for listening. You have one more question to answer before moving on. Have a great week.